Okay, me come. Sadie. Hi folks, good to see you this morning, and it's great to be here at this wonderful Medicare local here on Brisbane's north side, and also as a local member, Yvette Darth, and of course other folk here from Medicare local, including our Federal Health Minister, Tanya Plibersek. And the reason I'm spending a fair bit of time with Tanya on the road these days is because we've got a lot to say about health in hospitals, and we're proud of it, because that's a core priority for all Australian families. This morning we spent some time here with the good folk from Medicare Local and hearing about their great work. We heard a direct story about how the outreach nurses here were able to help find a condition in a woman who was suffering from a lump in her left breast. And through the outreach work here, that was able to be detected earlier than I think would otherwise have been the case, or at least given a path to treatment and diagnosis earlier than would have been the case. We also heard a moving story about a man suffering from incontinence, and how you deal with those practical and often very difficult and humiliating circumstances, and how through practical outreach you can help someone like that. And that's a good thing, because every person deserves their dignity. And we also heard about the excellent work being done by the cancer care nurses operating out of here, including palliative care with cancer sufferers in this part of the world. So I'm very, very proud of what all you good folk are doing here. It's part of the vision that we had when we set up Medicare Local, which now runs 61 such centres right across Australia and employs 3,000 frontline healthcare workers doing valuable work for Australian families and Australian households across the country. I'm also proud today to confirm that and to announce that we're investing a further $15 million to assist with cancer care coordinator nurses who will operate out of our regional cancer care centres across Australia. Here in Bris, we have a good concentration of tertiary healthcare services operating out of our major hospitals, both north side and south side. Once you get beyond Bris in Queensland, then regional cancer care centres are crucial, as they are right across the country. Up in the Sunshine Coast, where I come from, we now have a regional cancer care centre at Nambour. The first time we've had one of that order of magnitude. Out west of Brisbane, we now have one at Springfield. You go up the coast in Queensland, you have them at our major regional centres. And so too right across Australia. I think Tanya, you recently opened one was it Bunbury?
Bunbury, yep.
In southwest of Western Australia. And I think if you point to major and regional centres across the country, we have been doing this. Why is that important? We believe that the concept of an Australian fair go is that it should not matter where you are. If you begin to suffer from cancer, you should be able to access a high degree of services in your wider community, so that you don't have to pack up, bring the family to your state capital in order to get the services that you need. I think it's a part and parcel of what it means to be Australian, actually. It doesn't matter if you're in a country town, a regional centre, you should be able to have access to high quality health care, including cancer care as well. So we're proud of this additional investment of some 34 new cancer care coordinators who will be spread out across the regional centres so that they can do the sort of work that I've seen here being done by the cancer outreach coordinated by this Medicare Local here on Brisbane's north side. Here in Brisbane, I'd also emphasise the fact that the Health Minister has announced in recent days 50 new chemotherapy chairs across PA Hospital, the RBH, the Royal Brisbane, as well as Prince Charles. And of course our continued support in cancer treatment by providing funding for 57 cancer care nurses under the McGrath Foundation, which is a wonderful initiative. And also now 13 new prostate cancer care nurses through a separate program being funded by us through community organisations. All these are part and parcel of our vision for Australia's future, and that is building the health system and the hospital system that we want for the future, so that it doesn't matter where people live, doesn't matter what their background is, whether they're rich or whether they're poor, whether they're Indigenous Australians or non-Indigenous Australians, that they have a fair go and fair access to proper health care right across the country. That's what we're on about. Building the best possible health and hospital care for the future. Building the best school system for the future. Building the best broadband for the future, so that you have the same speed right across the country, whether you live in outer metro areas like this or in downtown CBDs. Also building a clean energy future, the new industries of the future, so that we provide the new jobs of the future. So we're in the building business in this government, and we're proud of it. And this is part of the house for the nation that we're building, our Medicare locals. Elections are about alternatives and they're about priorities. And our opponents, led by Mr Abbott, they're into the cutting business. Cut, cut, cut again. It's cutting in terms of $70 billion worth of cuts to jobs, to health and hospitals, to education. Also, in terms of cuts to the family budget, think about this: if his plan to review the goods and services tax produces a higher tax, which then is extended to food. That affects all families. And also we see a bit of reporting today about what an incoming Abbott government would do if they were elected to the future of the Fair Work Act. And the industrial relations spokesman for Mr Abbott's team refusing to rule out changes to penalty rates and overtime as a result of their changes to the Fair Work Act. So when we talk about cuts, let me tell you, it affects and hurts families' lives. If you're cutting $70 billion to jobs, health and education, that hurts families, hurts households. If you're considering increasing the goods and services tax and applying it to food, that hurts households and families. If you're going to take away protections for penalty rates and overtime, that hurts the family budget. And let me tell you, if you threaten someone's job, that's the most fundamental threat of all, because it takes away the household pay packet altogether. So all of this, I believe, comes together in the current great debate about the future of paid parental leave. All of these themes come together because it's quite plain, as the debate has unfolded on Mr Abbott's new proposal, that his plan for paid parental leave is unaffordable, unfair, and increasingly seen to be economically irresponsible. Let me just go into the implications of all this for all of the good folk of Australia. Let's firstly just go to the costings of this scheme. Mr Hockey has confirmed, it seems, that this will be $5.5 billion a year. So over 4 years, fully operational, we're looking at a massive, massive $22 billion plan in order to provide something like up to $75,000 for a certain category of families for 6 months when they have a child. So that's going to cost everyone $22 billion over a full 4-year period. Second point is this: how is this to be funded? Mr Abbott said on the 18th of August, when he launched this policy, that it will be fully funded by a 1.5% levy on Australia's top 3,000 businesses. That's what he said only a few days ago. Now we find out that in fact that is completely untrue. When Mr Hockey, the Treasury spokesman, was asked the question, how much will this levy on business cost and contribute to the overall cost of the paid parental leave scheme, he said, well, could be 50%, could be 60%, could be 70%. Already we see a crab walk away from the levy fully funding this $22 billion unaffordable, unfair and economically irresponsible scheme. So it's time to do a bit of maths on this. And we see from reports today in the Australian Financial Review, the West Australian, but also the Parliamentary Budget Office, when it's been costing another scheme based on a 1.5% levy on 3,000 business put forward by another political party. The Parliamentary Budget Office's conclusion is that a 1.5% levy would raise something in the order of $2.2 billion per year. So let's put all this together. Mr Hockey says it's going to cost $5.5 billion a year. That is, therefore, out for 4 years, that's a $22 billion program. Now we have the Parliamentary Budget Office and others in the press reporting that, in fact, the most this levy is going to raise is about $2.2 billion a year. So this levy doesn't raise 70%, of the cost of the paid parental leave scheme. It doesn't raise 60%. It doesn't raise 50%. At best, it raises 40%. And the key question for all of us is, where does the other 60% get paid for? Who gets cut in order to meet that $13 billion gap? I think this is a pretty important question for Australians, because right now that detail is being hidden from them. So this is a big question for all Australians. And today we have legitimately to ask ourselves what jobs will be cut to make up that shortfall, what health services, like cuts to Medicare local, will be delivered to meet that shortfall, what cuts to schools will be made to meet that shortfall. And of course, that's just that amount compared with the $70 billion which they say they've got to cut more broadly. Now we come to what the Shadow Assistant Treasurer, Mr. Matthias Cormans, has to say today. And he's reported in The Guardian, and let me just read it to you, this report from The Guardian, which I think I had here a minute ago. He actually says that when it comes to the franking credits that apply to the proposal for the paid parental leave scheme, that when it comes to franking credits for superannuation earnings, that they will not be exempt from this arrangement. I'll draw your attention to The Guardian's article. They've spoken to the opposition's Shadow Assistant Treasurer. So what does that mean? One of the cuts based on that is going to fall on self-funded retirees and fall on their superannuation earnings. In fact, Mr. Abbott, in one of his most recent communications, said there'll be not a single change which would affect people negatively in their superannuation. Well, let's be very blunt about it. If you're going to lodge and launch this sort of hit on people's superannuation earnings through a change to the franking arrangements for investment earnings, it's going to hit superannuation big time. So we've seen some calculations now as to what that amount could be. There have been reports in the Financial Review today that hit on self-funded retiree superannuation could be up to $1.7 billion. I see also Malcolm Fraser tweeting out this morning, investors take a $1.7 billion hit for parental leave, bad for retired people especially, inconceivably bad policy. So this is one example of where the rubber hits the road. I've talked more broadly about cuts to jobs, to health, to education. I've talked about what that could mean in the plans which Mr. Abbott is keeping hidden from the Australian people. But now we find that one of the ways in which they propose to raise money for their funding gap is by also hitting the superannuation earnings of self-funded retirees. I don't believe that's fair, I don't believe it's right, and it's completely inconsistent with Mr. Abbott's commitment to the Australian people. So, bringing these things together, paid parental leave, over a full 4-year period, $22 billion is what it will cost, based on what Mr. Hockey has said, on the annual amount of $5.5 billion. A massive, massive commitment of money. And on the way through, they're going to hit companies with a $9 billion levy. And guess what? That's all going to be passed through to you at the checkout. Ever known a big company to take a tax hit and not pass it through to you at the checkout? I don't. So that's number one hit. Then number two hit is what happens to the superannuation earnings of self-funded retirees, up to a $1.7 billion hit on super. And number three, we then still have $13 billion from this paid parental leave scheme of his, which could only be funded by as yet hidden cuts to jobs, health and education. And by the way, if you think that's off in abstract land, jobs, we see a report today that by withdrawing assistance to the car industry, 36,000 Australians would lose their jobs in Victoria alone and carve a $23 billion hole into the economy. On health and hospitals, we have the Shadow Health Minister today, who has an electorate just up the road from here saying he can't rule out cuts to health and hospitals. And on education, if you don't think the Liberal National Party is serious about cuts to education, talk to Campbell Newman about what he's done to the school system here in Queensland. Talk to Jeff Kennett about what he did to the school system in Victoria. 300 schools closed, 9,000 teachers sacked. And if you think that's all ancient history, go to yesterday's papers and find out that in West Australia, under Premier Colin Barnett, we've had 500 education workers sacked as well. So all these things come together around, frankly, a question of priorities and who gets hit, who gets hurt by what I believe to be an unfair, unaffordable and economically responsible policy for all Australians. It says a lot about Mr Abbott's priorities that he now tries to hide his plans to cut cancer care nurses and then tax retiree superannuation, all to pay for this unfair and unaffordable paid parental leave scheme of his. Over to you, folks.